All right, so I wanted to show you that you have good mobility in terms of side glide of the pelvis, and we tested the other side and that was quite mobile. And when I test posterior rotation movement, I can take up the slack and then I can spring it, and there is spring and recoil. So there's forward spring and recoil, and that's true on this side as well. Okay? So let's have you now lie on your stomach. So I'm going to test superior glide. So I'm taking up the slack in the structure, and then I spring it, and I see your head bob up and down. So the force translates through the SI up the lumbar, thoracic, cervical spine. And I'm taking up the slack and inducing spring, and I see spring and recoil. I see your head bob up and down. Now I'm doing a anterior spring on the ischium, and I see your feet move, so the force is translating nicely. Same thing on this side. I'm now springing anteriorly, and that has good motion. Same thing on this side. And now I'm springing inferiorly, and I'm taking up the slack, and now I spring and I see your heels bob up and down. So that force translates through the SI joint, translates through the hip joint, down to the lower extremity, and the same thing on this side. Where it gets interesting is when I come onto your sacrum and I test inferior glide. There's no give. I'm using a reasonable amount of force, and I'm even doubling that force, and there's no give. I cannot take up the slack, it's already taken up. Now this middle finger's on the tailbone, so I want to make sure that I'm on the lower sacrum and not on the tailbone. And I'm testing this joint play. Okay? Cannot take up the slack. Cannot spring it. Okay? And now I'm on the top of the sacrum, testing forward bending, and I don't get any movement here either. And if the sacrum's not moving, then L5 typically is not moving in terms of spring mobility. And here's L5, and of course you're fused at 4, you're fused at 3, and we're just approximately, but I feel movement here, so it's reasonable to say that this is probably L2. If I come down just a ½ inch, there's no spring here, it's reasonable to say I'm probably on L3, given that you have cages between where your disc spaces are. And so just to test mobility throughout your spine, this is how your spine responds to springing. So you have mobility throughout, and you have good rib mobility. So I just wanted to point that out. And what I'm going to do to try to improve mobility in your sacrum and L5 is I'm going to put 2 pillows under your stomach, up high, not under the bony pelvis, but above that. So I'm going to put your lumbar spine in flexion. Okay? Hopefully that puts the lumbosacral facets in flexion. Basically they are hyperextended. Okay? So I'll grab my spine and show you that on the camera. And so, in my opinion, the sacrum is hyperextended, and the same thing for the lumbar spine being hyperextended this way at that lumbosacral joint. I will put a pillow under your ankles as well, get some relaxation in your hamstring muscles, and then I will simply contact the sacrum and push inferiorly for 3 minutes. And that might be all that's needed to restore that mobility. Okay? If that's not the case, if I still cannot get backward bending of the sacrum, then I will put a piece of foam across the lower sacrum, and I'll have you lie on your back with your hips and knees bent 90 degrees. Okay? It's just a very soft piece of foam with wood in the middle. And that will encourage backward bending of your sacrum. Okay? So we can stop filming now, and I'll go ahead and